Hello everyone, welcome to Revert Hair Transplant Center Dehradun YouTube channel. I'm Dr. Amit Singh and I'm a hair transplant surgeon based in Dehradun, and I have been doing hair transplants in Dehradun and Roorkee for the past 10 years. Today we are shooting the most important video, the most important question in everybody's mind. Whosoever is thinking of getting himself a hair transplant, this question is in his topmost priority, and that question is, what is the fee for a hair transplant? What is the per graft charge at your clinic? This is the most common query we get through our inquiry section. So to answer this question, I will start by saying that the most important question, even far more important than the cost, is the safety of hair transplant. To ensure safety, you have to get your hair transplant by a qualified doctor only. He should be a qualified surgeon or a dermatologist. Besides these two specialities, don't ever think of getting a hair transplant by any other doctor. Most of the clinics where hair transplants is being performed, they are usually performed by unqualified technicians. If you are getting a hair transplant at these type of clinics, you are putting yourself at tremendous risk. Don't do that. It is my humble advice. Coming to the topic of today, that is the cost. How do we calculate the cost of a hair transplant? Per graft, the question you are constantly asking us is that what is the per graft charge? I must tell you, graft as such is no medical term. There is no medical entity like a graft. In hair transplant, we are not transplanting individual hairs, we are transplanting whole unit of hair root, which is medically it is called follicular unit. From a single follicular unit, 1, 2, 3 and up to 4 hairs can emerge from a single follicular unit. If I am transplanting a follicular unit which is having 4 hairs, then that will be equivalent to 4 hairs. If I am transplanting 1000 follicular units of 4 hair each, the final result will be 4000 hairs. And if I am transplanting 1000 follicular units of a single hair, that will be equivalent to only 1000 hairs. So to confuse the client, most of the clinics tell the client, they tell the number of hairs as equivalent to grafts, but that is not the true picture. We are transplanting follicular units, and whosoever is, just suppose I am transplanting at the time of extraction at the time of taking out of the roots, I make sure that I usually take out multiple hair roots that are having 2, 3 or 4 hairs. So, but even the doctor who is operating upon you will not be able to calculate the exact number of follicular units as well as the number of hairs. It is just an average calculation. So if the doctor who is doing your hair transplant cannot make sure the number of hairs, how can he charge per graft or per hair? So that is altogether a false notion. Whosoever is telling you a per graft charge is a false, he's telling you a false story. So don't fall into that trap. The policy we follow, you must know what exactly is going on during a hair transplant. To make sure the safety as well as to make sure that every hair root follicular unit grows, we have to make sure that we have to complete the hair transplant procedure in a time duration of 6 to 8 hours. If you are taking more time than 8 hours, the extra time you are taking in getting a hair transplant, the extra roots will die. You may be transplanting them in 12 hours, but the final result, there will be substantial hair loss, the hair roots will be dead, and the final result will be less. And you will be damaging your donor area as well. So in the time duration of 6 to 8 hours, if we are following the previous procedure, around 3 to 4,000 hairs, that is around 1,500 to 2,000 follicular units can be transplanted in the old method. And in the new and the latest feather test DHI hair transplant, which we do in our clinic, if your donor area is good, around 2,500 to 3,000 follicular units can be transplanted in a single session. That is equivalent to around 5 to 6,000 hairs. So 5 to 6,000 hairs can be transplanted in a single day session only if you have a good donor area. But you don't have to lose your heart if you have your donor area is not that great. The final result of hair transplant will not come on the basis of the number of hairs transplanted. If everything comes on the quality of your donor area as well as at your budget. In our clinic Revert, we follow a policy that a person who comes to our clinic for advice, we make sure we try to help him with the best of our availability. He may be having low budget, but we make sure whatever he or she is having as his budget, we give the maximum benefit we can give in that budget. We discuss this with every client of ours. The result, if a person is having less budget, he is not in a position to get the maximum that is possible, we advise him the best. The change in your looks is if you get the frontal side, the facial contour, this hairline and the mid scalp area dense, then you can derive maximum benefit and you can improve your looks immensely. So the first aim of every hair transplant, including us, is to make sure that we make the front area, the hairline and the mid scalp to the maximum density that is possible, which you can get in low budget as well. So if you are planning to get a hair transplant, you kindly visit us, get your budget discussed, what is your requirement, how can we give the best result possible. We advise every client to visit the doctor before finalizing your hair transplant. Don't go on that day only, meeting the doctor on the same day in which you are getting your hair transplant procedure done. Take your time. Nobody in this world is that much busy that you don't have the time even to make a visit, a pre-transplant visit to that clinic, meet the doctor before your actual procedure, discuss your procedure, your queries with the doctor, then only finalize your clinic and as well as the date. I'm sure and hopeful that the information, this video has exceeded the limit which I thought I would be able to explain, but that thing is most important. Cost, before asking the fees, you should ask for safety for the qualification of the doctor. Then only you should finalize your clinic. If you have further queries about hair transplant and other hair loss treatment, kindly subscribe to our channel, press the like button, and if you have specific query, you can send us your query on our WhatsApp, or you can directly call us. This is Dr. Amit Singh signing off.